Hey, Dr. Jerry Williams. I'm here to talk to you today about kidney stones. Uh, if you've ever had one, you'll never forget it. I had a very seasoned emergency room nurse tell me one time that she'd had five babies and one kidney stone, and she would take the five babies in a row over the one kidney stone. That really got my attention because this lady was a long time emergency room nurse and very, very seasoned. And when I laughed when she said it, she said, "No, Dr. Williams, I'm dead serious." So, kidney stone pain is quite exquisite. In fact, Jeff Foxworthy, one of my favorite comedians of all time, does a stand-up routine on kidney stones that is absolutely priceless. Now, if you're suffering from kidney stone pain, there's nothing funny about it in the moment, and I suggest you not watch that right now. But when you're over your kidney stone, and especially if you've been through one, or as a physician, I've never had a kidney stone, thank God, but I've taken care of a lot of patients with kidney stones, and Jeff Foxworthy's skit on kidney stones is priceless. I encourage you to go find it and watch it. But kidney stones can be a very serious medical problem, and patients who are prone to create kidney stones typically have these problems ongoing where they have recurrences of kidney stones, and it can really be debilitating and can affect the overall health of your kidney and can be life threatening. In fact, I lost a dear friend last August who passed away immediately after having had surgery for a severe kidney stone, and miss him terribly. So it's a very serious problem. In fact, right now I've got a good friend who's going through a kidney stone right now and is waiting to have lithotripsy, which is the sound wave therapy that shatters the kidney stone. He's waiting for a couple more days until he can get his appointment to have the lithotripsy done. So it's a top of mind topic for me right now. We see a lot of patients with kidney stones nationally at urgent care 24/7. And the primary presenting complaint is very severe pain in the abdomen, the side, or in the back, or we call the flank. And that's called CVA tenderness in the back here for costo, which means rib, vertebral, your spinal column vertebra, the costovertebral angle where the ribs and the spine come together. The kidney sits retroperitoneally in the back there, and the patients will experience severe low and mid back pain. The kidney stone patient is different than a patient with an acute abdomen like appendicitis or something like that. The kidney stone patient, whereas the acute abdomen appendicitis patient will lie very still, that's what makes them feel more comfortable. The kidney stone patient cannot get comfortable. They're constantly pacing and changing positions and moving. They just can't get comfortable. So that's one way to make the diagnosis is based on that behavior. The other symptom that's very common is nausea and vomiting, and the pain is so severe the patients will frequently have a very difficult time keeping anything down by mouth, and so there's a risk for dehydration. It also poses a problem, the nausea and vomiting, in trying to give pain medications by mouth because they can't keep it down. So frequently we'll give patients pain medications and at the same time give them antiemetics or anti-nausea and anti-vomiting medications to help them keep the pain medication down. Also, in that scenario, you can imagine that these patients can get dehydrated. And if you think about it, with a kidney stone, we want to have lots of urine flow to help flush that kidney stone out of the kidney, out of the ureter, and into the bladder, and then through the urethra and out. So it's not good that these patients can get dehydrated. So it's very important that they push fluids and that they can keep the fluids down. If they can't, they frequently require IV fluids to keep their hydration status or their intravascular volume up, so they're creating urine constantly. So kidney stones are they're of two types. There's uric acid kidney stones, and there's calcium oxalate crystals that can cause kidney stones. And when a patient has their first kidney stone, we encourage them to, we'll actually give them a filter to urinate through so they can capture the kidney stone when they ultimately pass it. And it can be sent to the laboratory for analysis to find out if it's a calcium based or a uric acid based stone. Because the treatments and the recommendations for those two different types of kidney stones are very different. So, patients who have a higher uric acid level in their blood are more prone to creating uric acid kidney stones, whereas patients who have a higher calcium level are more likely to have calcium based kidney stones. So, if you have a kidney stone, if you think you have one, you encourage you to push lots of fluid, and if you are having difficulty keeping fluids down or the pain persists or is worsening, seek medical attention immediately so they can assess your hydration status, give you effective pain management and anti-nausea and vomiting medications, and also imaging to determine the size of the kidney stone and if it's a stone you can actually pass without requiring lithotripsy or any more invasive intervention such as surgery or cystoscopy, where they actually will put a scope up into through the urethra into the bladder and up into the ureter to use a basket to capture the stone and to pull it out. So imaging to determine the size of the stone, whether they use X-ray or CAT scan or ultrasound, can be important to determine what's the best course of action. So in wrap up, if you got a kidney stone, there's some pretty distinct features that will point to that diagnosis. The most common symptoms being pain and nausea, and getting medical attention to determine the type of stone that you have, treating the symptoms effectively, and determining size of the stone to determine an ongoing treatment plan for conservative measures to allow the stone to pass on its own, or if more invasive requirements such as lithotripsy or surgical or cystoscopy are required. Now, one thing I would mention is there is a drug called Flomax, is the trade name. Tamsulosin is the generic name, and Flomax is actually used for prostate symptoms. It's also a blood pressure medication originally, but it's also used for benign prostatic hypertrophy that causes urinary retention in typically older males. But they've determined that in larger kidney stones, the Flomax medication is effective in helping pass the larger stones faster and with higher frequency. Now, that drug did not show an improvement in passing smaller stones, but that's because smaller stones pass on their own typically anyway without the medication. So the medication didn't show a difference there. So that's another option, that if you have a kidney stone and it's a larger stone, they may put you on Flomax to help you pass it. So I hope you found this information useful, and I hope you don't have a kidney stone. But if you or a loved one do, now you'll know how best to handle it. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.